There's a lot of different implant choices that are available these days. The two main options are a silicone gel-filled implant or a saline-filled implant. I tend to prefer the silicone gel-filled implants. I think they're softer, feel a little bit more natural. Both of them are good choices. They're both safe choices, and it really comes down to a matter of preference. Most people come into the consultation having done some research. Some people will have a pretty strong opinion on whether they prefer gel or saline, but if someone feels most comfortable with saline, I think that's a nice choice as well. As long as you're otherwise healthy, you're from a surgical standpoint, you're a candidate, and then it's just a matter of being evaluated to make sure that your goals are the goals that are going to be met with an augmentation. In general, under the muscle gives a little more camouflage to the implant. It can look a little bit more natural. It also tends to be a pocket that diminishes the chance of scar tissue buildup. Over the muscle can have an advantage of filling out a loose skin envelope a little bit better. If somebody is very active in bodybuilding or things like that, sometimes over the muscle prevents muscle movement that you may see with an implant. If somebody really wants a natural look, wants to just fill out perhaps what someone has lost with age or breastfeeding or things like that, definitely it's something that can be done. So I mean, if you want to choose an implant size that makes you noticeably larger, they will know. If you're really just trying to reshape what you have or give a real modest change, they won't know. We also have to accommodate for those other breast changes that have gone on. Do we need an implant that's going to give us a little more lift? Does the patient actually need a breast lift with the augmentation? So we need to evaluate all those factors and then make recommendations for what surgical plan, what implant type are going to give us the result that the patient and I both agree is going to be a nice result. If somebody comes in wanting something that seems unrealistic, I have to tell them that I don't think we can meet the goal that you want, and try to help them realize what is realistic. People need to understand what goes on with the surgery, what it can do, what it cannot do, so that they know what the result may be and they can feel comfortable with it. Usually it's an outpatient surgery. You go home the same day, and I usually tell people they should expect probably 5 days of really taking it easy. You may need to take a dose of pain medicine. You may need to be off of work depending on what kind of work that you do. Usually after that, people do well enough that they can go back to light normal activity. It can take a while for the soft tissue of the breast to kind of stretch and accommodate the implant. And so there is a settling process that can go on. And it really kind of depends on where you are to start, what size implant you're putting in, as to how long that process takes. I'd say for everyone it's at least 6 to 8 weeks till everything kind of settles into position, but for some people it can be several months longer. Usually what I tell people is you will look fine in your clothes, in a bra, in the bathing suit, but without clothes on it can take a couple months for everything to completely settle to where it's going to be. Next step is making sure that you're medically fit for surgery, and then proceeding with getting things scheduled. Get our date and time scheduled, make sure that you can make your plans, take the time you need to recover,